everybody. I am going to discuss the pleura in two sessions. Hence, the presentation is divided into two parts. At the end of this first session, the learner should be able to define the body cavity, the coelom, and classify the body cavities, define the pleura, describe the anatomy of the pleura, parietal and visceral, describe the parts of the pleura, describe the pleural cavity and the pleural recesses, describe the blood supply, innervation, and lymphatic drainage of the pleura. Body cavity versus coelom. Body cavity is just a hollow space inside the body, whereas coelom is a hollow space inside the body lined with mesothelium. Body cavities are divided into two sets, dorsal and ventral body cavities. This slide shows classification of the body cavities. Today we are to discuss pleura, which surround lungs and lie in the thoracic cavity. Why body cavities? Number one, compartmentalization allows viscera to expand and contract without distorting other tissues or disrupting activity of nearby organs. Cavities provide protection to delicate viscera. Septals in among the cavities act as a safeguard to limit infection. Pleura or pleural membrane is a double-layered serous membrane which covers each lung and lines thoracic cage. Outer layer which lines the thoracic cavity is named as parietal pleura, whereas the inner layer which covers the lung, etc., is named as visceral pleura. Both these layers are continuous at the root of the lung and pulmonary ligament. Hence, pleura is a closed sac. Both layers are separated by a variable space, the pleural cavity. Pleural cavity is a pair of serous fluid-filled closed sac or space inside chest, located between two layers of pleura, visceral and parietal. Surrounds and separates lung from surrounding structures. Fluid in the cavity allows lungs to move freely during breathing. Parietal pleura is the outer layer of the pleura which forms pleural dome at thoracic inlet and lines chest walls made up of sternum, ribs, costal cartilages, intercostal muscles, sides of thoracic vertebrae, mediastinum, and upper surface of diaphragm. It is separated from overlying thoracic wall structures by endothoracic fascia and is divided into following parts. Cervical pleura is dome-like. It projects above thoracic cage into root of neck. Being superficial is more vulnerable to injuries. It projects roughly 2 inches above first costal cartilage and 1 inch above medial one-third of clavicle. It is it covers apex of the lungs and itself is covered by suprapleural membrane. It continues with costal and mediastinal pleura below. Diaphragmatic pleura is a thin layer tightly adherent to upper surface of diaphragm, continues with costal and mediastinal pleura above. Next is costal pleura. It lines thoracic cage, sides of the thoracic vertebrae, and continues above with cervical, below with diaphragmatic, and anteriorly and posteriorly with mediastinal pleura. It is separated from the thoracic wall by endothoracic fascia. Mediastinal pleura covers side of the mediastinum, mainly fibrous pericardium, esophagus, and thoracic aorta. Continues with cervical pleura above, diaphragmatic pleura below, and costal pleura both anteriorly and posteriorly. It reflects and becomes continuous with the visceral pleura around root of the lung and pulmonary ligament. It, like diaphragmatic pleura, it is tightly adherent to the mediastinum. Visceral pleura is a delicate thin layer firmly adherent to the lung surfaces. It extends into the fissures as well. Mediastinal parietal pleura and visceral pleura continues as a tubular sheath which is named as pleural cuff that surround root of the lung in the hilum of the lung. It hangs down as a fold pulmonary ligament which provides space for expansion of veins during increased blood flow, such as in exercise. Pleural recesses. These are pocket-like potential spaces in the pleural cavity. These spaces appear at the sites of pleural reflections, and they are meant for lung expansion during deep inspiration. There are two named pleural recesses. One is costodiaphragmatic and the other one is costomediastinal. Costodiaphragmatic recess, which is also named as costophrenic recess, is located at the reflection site between diaphragmatic and costal pleurae along inferior border between inferior margin of lung and pleura. These gutter-shaped, being most dependent parts, surround convexity of diaphragm against lower part of thoracic wall. It has got a diagnostic significance on radiography for detection of fluid collection. Costomediastinal recess is located at the reflection site between costal and mediastinal pleura along anterior border of lungs behind sternum, as shown by black arrow. Its size is larger on left side because of cardiac notch of the left lung. Normal pleura and pleural spaces are not visible on plain radiograph of chest. They only become visible when abnormal. Thickened pleura in lung fissure appear as white lines, whereas pleural spaces become visible when there is accumulation of fluid. Normal lung marking should reach the thoracic wall. As a rule of thumb, blood and nerve supply of pleura come from structures lying underneath it. Nerve supply of pleura. First, the parietal pleura. The cervical part of parietal pleura receives innervation from phrenic and intercostal nerves. Costal pleura receives from intercostal nerves. Mediastinal pleura from phrenic nerve, whereas diaphragmatic pleura is divided into two parts. The central part around central tendon receives innervation from phrenic nerve, and the peripheral part receive innervation from lower 6 intercostal nerve, whereas visceral pleura, which is present on the surface of the lung, receives autonomic nerve supply through pulmonary plexus. Blood supply of pleura. First, the parietal pleura. It receives blood predominantly through arteries supplying thoracic body walls. Costal pleura receives through intercostal arteries. Mediastinal pleura through pericardiophrenik arteries. Diaphragmatic pleura through musculophrenic arteries. Cervical pleura through transverse cervical arteries. Visceral pleura through bronchial arteries, whereas the venous drainage of the pleura is through the corresponding veins. Lymph drainage of pleura. First, parietal pleura. Lymph vessels from this part of pleura drain ventrally to the nodes along internal thoracic artery, dorsally to the intercostal lymph nodes near the heads of ribs. Additional drainage is to the mediastinal, cardiophrenic, diaphragmatic, and extrapleural nodes. One thing to remember is that cervical pleura is drained into the axillary lymph nodes. The visceral pleura is drained into the bronchopulmonary lymph nodes in hilum of the lungs. Comments and suggestions will be welcomed. Thank you for listening and watching.